Welcome to a special Best of Vision Care episode of Care Experts. We've put together the most popular and talked about episodes of the year. We'll be hearing from Dr. Alexandra Chebil about digital eye strain, LASIK eye surgery, myopia, and aging eyes. Let's jump in.
So I'm very interested in this topic we're about to talk about, which is digital eye strain. So I know so many of us spend so much time staring at our phones and screens. So tell me, what exactly is digital eye strain?
As you focus on the computer or even on your cell phone, you don't blink as much and your eyes get dry, they get irritated, you can get a headache, you can have neck ache and backache, and it's all related to the blue light in the computer, the lighting, the glare. All of these can cause your eyes to be strained when you're doing a lot of digital work.
So what exactly is it that causes the digital eye strain? I know you mentioned the blue light. So is it that specifically?
It's blue light and the fact that when you're looking at a digital screen, even in children, you don't blink as much. So the natural reflex when you're looking at something is to blink, but when
Yeah.
you're staring at a screen, you don't blink. And it's becoming a real epidemic, digital eye strain, even in children.
So what are some things that people can do to maybe help them not get this digital eye strain?
First of all, you have to put yourself in a good working condition. You have to eliminate glare. Glare is a big problem causing the digital eye strain. So if possible, try to reduce the brightness on your screen.
Okay.
Get rid of the ambient lighting that can be a distraction, sun coming in, uh, bright white walls, if you can reduce the brightness of the walls if you're in your own home or your workplace. Also, fluorescent lighting can be a factor. If you can turn down any kind of artificial lighting, reduce that. Maybe have a desk lamp that's giving you more natural lighting. So getting rid of the glare, putting yourself in good working conditions, meaning keep your feet on the floor so that you're stable as you're using your screen. If possible, adjust the distance that you sit away from your computer screen. Ideally, it's 20 to 24 inches. And if you can get the appropriate angle that you're looking at the words that you're reading. So if you're looking at, don't look at something straight ahead. Ideally,
Yeah.
it's 10 to 15 degrees below the horizontal. That'd be the ideal angle to do your computer work.
Thank you, doctor.
Now let's hear what Dr. Chebil has to say about LASIK eye surgery.
So let's get right into it. What exactly is laser eye surgery?
Laser eye surgery is a procedure that's been around for about 30 years. Way back 30 years ago, if a child was told they had to have glasses, it was a life sentence. They were stuck with glasses forever. So it is a technique that has evolved over the past few years. We can treat nearsightedness, farsightedness, and astigmatism all together and hopefully get rid of your glasses and contact lenses permanently. It's a life changer.
So what kind of results should a patient expect after LASIK? Will they be able to see 20/20?
Well, short term, the vision is a little bit blurry. You have to see that it is eye surgery. It's not like putting on a pair of glasses. So your eyes have to take a normal time to heal. For the first few hours, it's going to feel a little scratchy, burning. Everybody I've treated going back 30 years ago has been able to at least get driving vision on day one. Driving vision is 20/40 according to the DMV. Most people get 20/20. If it's not the first day, then certainly within the first week or so. It all depends too on how high your prescription is. If you get in a very high range, like over 4, some people I've treated have Coke bottle glasses. They're in negative 12, never negative 14, and those folks can take a couple of months to get the full 20/20.
So walk us through the procedure.
First of all, a patient has to come in to see if they're even qualified.
Okay.
That's the first step because we want to make sure that your prescription is stable. You have to be over the age of 18. That's an FDA requirement. And you have to be within the treatable range. So we really have a high range of vision that we can fix. Nearsighted people, we can treat up to a 14. Farsighted people up to about a 6, and then astigmatism up to about a 5. The numbers have to be treatable. Other criteria, you can't have a really dry eye. You have to have the cornea, the surface of your eye has to be nice and smooth, and you have to have good overall health. Those are the criteria. So that's the first step, making sure you're a candidate. You lie down under the machine. I put a lot of numbing drops in. I hold your eye open.
Okay.
That's the most important thing. You have to stay still.
Okay.
The actual laser time is somewhere between 20 to 40 seconds, depending on how high your prescription is. All the patient needs to do is look up into the machine. There's a blinking red light. It's called a tracking light. So it's kind of like the missile-guided tracker things that you see on Top Gun, where you're locked on target.
Yeah.
So the patient is looking up at this red light that's moving.
Okay.
If the patient moves, the light moves. It tries to find where your eye is.
Got it.
And that gives you the best possible vision.
Thank you, doctor.
Now for Dr. Chebil's insights into myopia, or nearsightedness.
So can you tell me what exactly is myopia and what causes it?
Myopia is the medical term for nearsightedness. So if a person can see up close without glasses, but they need glasses for driving, for seeing the TV, typically they are nearsighted or myopic.
Now, is myopia hereditary? If one of my parents were to wear glasses, does that mean I have more of a chance of having to need glasses or contacts too?
It's not automatically hereditary, not from parent to child. There are family histories of myopia, but you can have one person with glasses for driving and then nobody else in the family needs them. The only type of myopia that is hereditary is the really, really high prescriptions. Sometimes you see an entire family where the children start wearing glasses for distance vision when they're 5 years old,
Yeah.
and that typically deteriorates quite rapidly. That's called high myopia or extreme myopia. It's very rare, though.
And how exactly is it treated?
You can wear glasses or contacts. That's not a treatment, but that is a quick fix for it. That would help the child see the blackboard at school and to do sports. The actual only permanent treatment, or one of them, would be the refractive surgery, which is LASIK or PRK.
Thank you, doctor.
Finally, let's see what Dr. Chebil has to say about aging eyes.
So can you just talk to me exactly about how our eyes age over time?
First thing that's going to happen is a reading vision problem. That's called presbyopia. So depending on the age, it can be sometimes, usually around 45, but sometimes a little younger, sometimes a little older. And this is where people who have very good distance vision all of a sudden have problems with reading. It's not really an eye problem, it's a problem with your arms. It's the short arm syndrome.
Yeah.
You can't hold the book out far enough, so you eventually you have to get your eyes checked and see if you need reading glasses. So that's an inevitable change that happens. Other things that are preventable as you get older would be cataracts, glaucoma, and really the worst thing would be the macular degeneration. So those are the last three things are sort of preventable, not always, but certainly you can do something to mitigate the damage.
Wow. What are some other common effects of aging eyes that we should be aware of?
Dryness is very frequent over the age of 50, particularly in women. Dryness is a big issue that needs to be addressed on the front end. You can also have eyelid problems. You can have droopy eyelids. You can have tear duct problems that are associated with age. And then I mentioned previously the macular degeneration, which is age-related, to a certain extent hereditary, but that also can cause a huge loss of central vision. So you could lose the periphery of your vision with the glaucoma and the central vision with the macular degeneration. All of those are picked up at your annual eye exams. Really important to maintain that.
Is there anything we can do to just help keep our eyes maybe more healthy, more young?
It's all about environment.
Okay.
So you want to stay out of toxic environments, stay away from smokers, stop smoking yourself. That's not that you smoke, but if you did, stop smoking. Diet is a key factor too. Omega-3, they're the vitamins, not necessarily supplements. You can get a lot of those things in a natural, normal diet like we have here. So vitamin A, B, C, and then there's certain supplements which contain zinc and keratin. Those are also beneficial for preventing cataracts and macular degeneration.
Thanks for joining us for the special Best of Vision Care episode of Care Experts.
All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. All information, opinions, and recommendations discussed in this episode are for your information only. We believe the information sources are generally reliable, but because of possible human or mechanical error by the sources, Synchrony or its affiliates, including CareCredit, does not provide warranty to the accuracy, quality, or completeness of the information or any results obtained from it. Any statement or opinions in this episode are the doctor's alone, and included data was current to the time of creating this episode. Please consult your own advisors before using any of this information.